Welcome to the next Myndful Health Discussion with Mind Myself. And today we are talking about vitality for breast health, thriving together. We talk about breasts in the media. You hear about breast cancer, but we don't really talk about breast health much and what is proactive breast health. So we're going to dive into that topic for a bit today. And I am Esther, founder and CEO of Mind Myself, and we welcome you to go and visit the site. Our goal is to help you become your own best health advocate. And we are cultivating unity in times of divisiveness. There is a great divide these days. And so we want to cultivate unity and kindness and respect. And we want to help you feel seen and heard and supported in your journey. And a thank you to my team and my supporters and the regular people who come live to these events. Much appreciated. And in the chat, Megan has put, what questions would you like answered in today's session? So if you're thinking of something and we do our first hour and you go, oh, I really want this answered, feel free to put that in the chat. We're going to monitor it. And for the last 30 minutes of our 90 minutes together, we will have a Q&A session where you can talk to our fantastic practitioners. And before I go any further, I love to do a land acknowledgement. So I respectfully acknowledge the traditional land stewards of the Katsi, Coquitlam, Kwantlen, and Kakite First Nations and their ancestors, on whose lands I live, work, and play, and whose waters I drink. This land is also known as Surrey, BC in Canada. And no discussion on health would be complete without a disclaimer, so here it is, and I'm going to read it quickly. All the information and advice from Mind Myself and the practitioners is for general educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information here and on the Mind Myself website should not be used to self-diagnose or self-treat medical conditions. We always recommend that you consult with a doctor or other qualified healthcare professional for individualized medical advice on specific medical issues. The views and values of each practitioner do not necessarily reflect the views and values of Mind Myself. So let's take one deep breath together and hold it for the count of 3. And release. Thank you for being here and getting grounded. A couple of things to set the tone. Your breasts are a sacred part of your body. And men who are here or listening to this, you have a chest area and it's really close to your heart, so you can listen to this too, but I'm sure you have some women in your life who this will be important for. So your breasts are a sacred part of your body, deserving reverence and care. Cherish them as a symbol of your inner strength. And also, in matters of health, it's always better to be proactive than reactive. And we're going to be talking a lot about that today. Proactivity versus reactivity, and what is prevention versus what is detection. We have 4 fantastic practitioners today with us. We have Dr. Anna Lopez, who's a naturopathic doctor. She's in Vancouver, British Columbia. Melissa Crawford, MD. She's from Nelson, BC in Canada. Jan Jeremias is from Connecticut, and Dr. Nilima Deshpande is in Pune, India. So welcome. I would love for each of you to introduce yourselves for about 30 seconds and just give our listeners a sense of who you are and what you're passionate about. Jan, why don't you start us off?
Hello, everybody, and thank you, Esther, and Mind My Health for having me, and such a joy to be here. I'm Jan Jeremias. My background is clinical research science for 24 years. My specialty was immunology and infectious disease, and I worked in women's health. Started my path in cervical cancer and then ended up working in sexually transmitted disease work and breast cancer research before I transitioned into more holistic ways. And now I combine both my background in science and more holistic modalities.
Thank you, Jen. Melissa, yes, this is how we show applause here because you can't hear the clapping anyway. Melissa, over to you.
Hi, I'm Melissa Crawford, and I'm a former family doctor, and I did some training in functional medicine many years ago. Throughout my own health journey, as well as my son's, we experienced pretty significant disabling health issues, and it was energy medicine and vibrational water remedies that turned things around and transformed our life. And so I decided I couldn't stay in the system anymore. My soul could not tolerate being in the medical system. So a few years ago, I finally left and just have continued to train in energy medicine and vibrational water remedies. I've also done yoga training, and light therapy and gentle detox treatments and that kind of thing. And one of my personal health experiences was experiencing breast cancer and healing from it naturally. So I'm really passionate about this topic.
Thank you, Melissa. Look forward to hearing some stories from you too. Absolutely. Dr. Anna.
Hi, my name is Anna Lopez. I've been a naturopath for 17 years. Predominantly, I see women, and I have been doing a lot of breast health for, I'd say since 2011. I do offer breast thermography for women. And so that's through that I've learned a lot about the breasts, and I've done thousands of breast exams. And so I feel like I have pretty good advice to give on that topic.
Fabulous. Thank you, Dr. Anna. Dr. Neelima.
Thank you, Esther. And good evening from India. Good morning to all of you there. I'm Dr. Neelima Deshpande. I'm a gynecologist. I'm based out of Pune. I trained in Pune and the UK. So my background is in OBGYN to start with, and then in sexual and reproductive health, genitourinary medicine. I transitioned into psychosexual medicine and then into a range of psychotherapeutic modalities. I started a clinic called Booms way back in 2018, which was breast osteoporosis, urinary incontinence, menopause, and sexual health. And I was building through this because from adolescence way into old age, and I want to point out it's not just women who get breast cancer, men get breast cancer as well. So since my practice looks after both men and women with sexual health issues, and I also look after a lot of couples who run into problems because of body dysmorphia relating to breast disease, breast surgery, and the way the breast is depicted in sexual contexts through the ages. That's been a topic of interest more lately, because we have so many wonderful architectural ruins, throughout India. All of the temples, they depict women and their breasts in a very unique way. And it caught my interest of being a sexual medicine practitioner, and also being interested in women's health as we age. And we all know that breast cancer incidence increases with age, and all of the various environmental factors, the nutritional factors, exercise, etc., that affects both the diagnosis and the prognosis of breast cancer. So that's where I come from.
Thank you, Dr. Neelima. It's going to be a rousing discussion. So happy to have you with us, all of you amazing women. Let's jump right in. What does it mean to have healthy breasts? And I'm going to get Melissa to start us off, please.
Okay. Well, I would say in my practice, I frequently see women that aren't connected to their breasts. It's almost like that part of their body, they're not conscious of it. And so I would say having healthy breasts first is to have a healthy connection to your breasts, and to also physically have healthy breasts that aren't lumpy and don't have rashes or any of those kinds of abnormalities, where the energy is flowing, the lymph is flowing, there's healthy blood flow going to them. And yeah, just I would say that's what I would say is healthy breasts.
Fantastic. Thank you. Dr. Anna.
Yeah, sorry. To me, it's obvious. I mean, the most obvious is having healthy breasts that don't have cancer. That's, But also, I mean, I would second what Melissa said, that we do, we want breasts that are not, terribly painful, that are not really cystic. And I think a lot of it does come from balancing hormones, looking at lifestyle factors, emotional causes, things like that. I do see a lot of women who have never, done a breast exam on themselves. I've never touched their breasts. They're always scared. And so part of what I do is I teach them how to do that, and sort of, learn about your bumps, your lumps and bumps, and, then you're able to see if something is changing. You'd be the first one to recognize it and, find some help, right? So yeah, but I do think that there is a disconnect sometimes between women and their breasts, and for whatever reason they may not like how they look, or there's maybe some history of cancer in the family, and so they're so afraid to touch them that they don't really know what's going on.
Thank you. Yes, becoming comfortable with our bodies, including our breasts. What is the status quo? What is it like on a regular day-by-day basis? Jan, can you comment on this from your perspective?
I love what everybody has shared. I think for me, somewhat similar is that whole idea of body awareness, as I like to say. And that's not only with breasts. Like a number of people on here, I've been practicing yoga for, and teaching for over 20 years. And it always surprises me how little body awareness in general people have, male, female. It's like they have no idea about their bodies, where they are in space, what that means, their relationship to their bodies, especially in today's day and age. So that healthy relationship of like non-judgment and not comparing yourself to anybody else, which I think is huge, because that's so much a part of it, right? Is how we see ourselves. And so really kind of getting in touch with yourself and knowing what is your body like, and learning that from as young an age as possible is really vital. I mean, I'm a little older than I think some of you. And for me, it was always like, I grew up in the era where basically, people didn't talk about stuff like that. Everything like that. And even families didn't talk about, like, you were given a book when it became time for your menstrual cycle, and there was no conversation, nothing, that kind of, okay, Esther, thank you.
That was me.
And so all of a sudden, like so much of it was like, oh, okay, you gave a book, but there was no conversation and no dialogue about it. So it became almost something like a topic that was feared, like, or buried, because it was like, oh, okay, it was something you didn't discuss, like things like that. So I think that to me is a healthy relationship, to realize you can call a friend or have a conversation with your doctor about topics like these. So it takes away some of that fear.
Thank you, Jan. Dr. Nilima, what does it mean to have healthy breasts from your perspective?
I think my perspective comes from a lot of patients' perspectives over the years. And one thing I will say is having functional, especially women going through adolescence, pregnancy, as they get older, particularly all what everybody said about the healthy connection with their breast, but also having the confidence that the breast actually does what it's meant to do. So they're confident throughout their pregnancies, they know how to handle their breast, they know how to breastfeed, they know what the recovery period is. So having that awareness and knowledge about the care that they give their breast. Also, another thing, most people don't pay attention to their body unless it either hurts, it pulls, it strains, or there's a discharge, or there's blood coming out of it. And I think the normalization is like, in the absence of this, it might be normal. And actually, that's not true. And it was brought to us in a really funny way. I remember during our third MBBS class, we were attending a breast class. And I was in Lady Hardinge Medical College, which is an all-girls college. And the surgeon was a man. Typically, he was like, oh, I saw a lady today whose husband diagnosed her breast cancer. And women should be more aware of their bodies, shouldn't need somebody else to diagnose the problem. And that brings everything, because we just sat there and giggled. Oh, he's talking about breasts. Oh, he's talking about a man detecting a cancer. But the truth is that women don't notice their bodies unless there's something wrong with it. And I think that's the opposite of knowing what healthy is. There's more to health than something not being wrong with it. So, bringing all of the holistic approaches together, appreciating both the size, shape, form, the aging process, the changing dynamics of its functionality, of how it feels on the body, including when it's not so comfortable, but it's still so-called healthy in the medical profession. For example, women with very large breasts who have neck and back problems. There's nothing wrong with the breast, except that they're causing a lot of damage. So understanding that health and well-being can also go with functionality. It can also go with feeling good about having them or having whatever you've got.
Thank you, Dr. Nilima. And for everybody listening today, I'm not necessarily going to be asking every question of all the practitioners. So if you see me skipping, we'll come around to people as we get to them. Our next topic, hormones and breast health. And I know many of the women who come to the Mind Myself website and attend these seminars are 40s and up, 40 to 55 plus. So hormones and breast health. How would you comment about how those are related? Dr. Anna, can you start us off?
Sure. Well, hormones rather influence your breasts in a big way. When you're menstruating, your breasts respond to all the changes that are happening with your hormones. And that your breasts tell you that things are happening, that your period is coming. And so absolutely, they really, respond to every little change that happens. And later on, when you're in, perimenopause, they do seem to respond particularly much more to the fact that now you've got, more estrogen than progesterone, and things are becoming more sore, and suddenly you feel more lumps than you did before. And so, yeah, it plays a big role in breast health.
Thank you. Melissa.
Yeah, I agree. As a family doctor, when I see women coming in with lumpy breasts or painful breasts or breast cancer, they almost always had estrogen dominance. So more estrogen in ratio to the progesterone. And often what I found was sort of underneath that on a physical level was a really congested liver, and that wasn't able to fully detoxify and metabolize the excess estrogen in the body, which sometimes can be due to toxins like xenoestrogens in our environment from plastics and things like that. And also just our own hormones. If the liver's not able to detoxify properly, then a lot of things will build up in the body, and that includes estrogen. And then the way that most of us are living our lives in constant stress, the adrenals aren't able to produce enough progesterone. So you have this big imbalance in the ratio between the two, and they should be closer together. There should be a healthy ratio there. So that chronic stress and congested livers are a huge part of hormonal imbalances, I would say. So toxicity plays into that, but also on a more mental, emotional, spiritual level, which is, I'm still advising on all this physical stuff and giving recommendations to people, but I find that going even deeper, why is this going on? A lot of it comes down to the disconnect with our own feminine energy and having this imbalance in our, feminine hormones can really come, and the disconnect to these female body parts can come back to trauma that women experience, sexual trauma, that kind of thing, or just ancestral trauma of that origin that we're holding in ourselves. And so there's this fear of connecting to our feminine essence. And I see that play out in the imbalance in hormones and the disconnect between women and their sexual and reproductive organs and their breasts.
Thank you, Melissa. Dr. Nilima.
Thank you. They covered a lot of the female hormone stuff. I also want to say that today, especially in India, India is the capital of diabetes, hypertension, stress, all the abnormal hormones that go on in people's bodies. And I see a lot of women with breast issues relating to diabetes, so skin problems, nipple changes, acanthosis, blackening of the skin around the lower part, candida, fungal infections underneath the breast caused by this heat, the kind of clothes we wear. So breasts aren't just responding to internal hormones. They're also affected by the other hormones in the body, thyroid dysfunction, pancreatic dysfunction, stress. All of this stuff also, gets manifested as breast issues.
Thank you. And Jan, unless you have something to add about hormones, I would like to ask you to start us off with symptoms and signs to pay attention to about breast health. And you're muted.
Thank you. No, they covered that quite beautifully. I think you need to look at, as mentioned before, any sort of changes that you see that are obviously like obvious. So difference in size between breasts, discharge, changes in skin, coloration, discomfort that's abnormal to you. And then to Dr. Nalima's point, since I do spend a lot of time talking to people about structural issues, is sort of, I always say that you can't look only at the area itself. You have to look at other areas of the body which might not be obvious. So all of a sudden, like underarm pain and sort of like swelling in that area, or even swelling in the upper chest or clavicles, that kind of thing, where it might be lymphatic blockages, extreme pain in the upper back, like the shoulder blades, because we're three-dimensional beings. We're not one-dimensional. We think of our breasts as only being in the front because they're obvious. We see them. It's really obvious. We look in the mirror. But what's happening that you feel in other areas of your body that might be contributing to that, or maybe you haven't, don't associate it. So don't ignore whatever's going on. Kind of look at it objectively and just think to yourself, at least to start the conversation, even with yourself, could that be contributing to whatever's going on in my body?
Thank you, Jen. Dr. Nilima, symptoms and signs.
I think the worst symptom that a woman has, dreading, is finding a. So I think coming from a country like India, the first thing women do when they find a lump is to go and meet a guru, or find some herbs, or get some ash, or wait until the husband comes home, or wait till the son comes back from America, or wait. They just keep waiting, and that's a disaster. Discharge from the nipples, change in the skin color, texture, appearance, like Jan was saying, armpit swelling, lymph nodes enlarging, finding enlarged veins on the surface of the breast, noticing irregularity. And I just talking back to what Dr. Anna was saying, is getting familiar with the breast, so you actually recognize something not being okay before it actually happens. So paying attention to the breasts immediately after a period, noticing if you're familiar with self-examination and doing that regularly, noticing differences, pain where there wasn't pain before, or painless lumps, which are some of the most alarming ones. And again, swelling, swelling in the above the clavicle, neck pain.
Thank you. Sometimes you're coming in and out a little bit, Dr. Nilima, so just make sure you're close to your camera. Melissa, maybe share a little bit about your journey. You said you've experienced breast cancer, so if you're willing to share a little bit personally, that would be amazing.
Yeah, well, what I noticed first was pain, and then with the pain, then I inspected it and noticed lumps, and they were irregular. So that's often more of a warning sign compared to maybe cysts that are more regular, like round in shape. So there was two lumps in my right breast, and I worked with a medical intuitive, which is what I do now. It's one of the things that I do, and she's the one who first picked it up. I went to see the doctor because I wanted to also see about getting an ultrasound. And I didn't have a very positive experience with this doctor. He didn't even examine me. He just said, "What do you want?" And so I said, "Well, I'd like to start with an ultrasound. I know this is abnormal, and maybe eventually I'd consider other imaging, but let's start with an ultrasound." And so he ordered it, but not urgently. So it took a month for me to actually get the ultrasound. By the time the ultrasound came around, the lumps were completely gone because I had started all this other therapy really intensively. And so the ultrasound confirmed there was nothing there, which was great. But it would have been really nice to have the before and after medical imaging. So yeah, so I was taking some herbs. I was working with Chinese medicine and indigenous medicine practitioners. They had me on some herbs. I was working with vibrational water remedies, as I said, and she's a medical intuitive that picked up on the cancer. And I was doing therapy to look at the emotional stuff that was the root cause of it. I had just gone through a separation and some really difficult emotions weren't processed, and it showed up in my breasts, and also the self-sacrificing that I was doing. I had a really sick child as a result of vaccine injuries, and I was just giving, completely focused on him, not taking care of myself whatsoever. So I had to like really do some emotional processing work around all of that stuff. And within 3 weeks, like I had a really miraculous kind of quick healing, which is not always the case. So I was very, very blessed, and they were smaller lumps. So it was very early. Yeah, so pain was pretty significant, and swelling feeling under the armpits. Those are my symptoms. The other thing I'm not sure if anybody mentioned is like a deviation in the direction of the nipples. Somebody might have mentioned that. I was kind of busy in the chat a little bit. Yeah, that can be another sign for some people, or even like pitting in the breasts. Yeah, so those are the other two things I would add. So that's my experience with breast cancer.
Thank you, Melissa. And wow, what a journey that you were on. And I was looking in the chat too, the exchange with Rusty and her journey as well. Dr. Anna, do you have anything else to say about that? Or would you be comfortable moving on to screening and prevention? What's the difference? And what are some of the options available to us? I know Melissa just referred to some, but from your perspective, what's the difference between screening and prevention?
Yeah, I think screening is part of prevention. Prevention to me includes, looking after yourself, looking at eating well, not having too many vices, things like that. I think women are really over functioning in our society, and often the self-care is just not there. So if there's too many roles that we need to play, too many things to do, working, taking care of kids, a household, we manage the home quite often, and so then sometimes we sort of don't do a lot of self-care, and that includes eating properly and noticing like that something is going on with our bodies. It's not sometimes there, or it's ignored because there's other people to take care of. So I think part of prevention is definitely obviously looking after yourself, finding the time to exercise and eat well, drink water, hydrate, not live on coffee only. So and then the screening part is finding methods that are you feel comfortable with doing. One of them, the easiest one is just a self-exam at home. And then of course there's the other ways that ultrasound and mammograms and that type of thing. So yeah, I think the screening is part of prevention, but I think prevention is like one of the biggest things, right? And so yeah, if you are needing alcohol to cope with life, then it's, looking at that and going, okay, maybe I need to slow down. I need to delegate, or, So looking at your life and seeing where you can decrease the stress, because I think stress is really killing us.
Thank you, Dr. Anna. Jan, the difference between screening and prevention from your perspective. You're muted, Jan.
Thank you. I look at screening as being something that's almost like outside of yourself. It's like, it's modalities that look of like, and I'm not being critical of them, but going for things like ultrasound, mammography, thermography, and they're very valuable. But to me, there's that disconnect between ownership of your own health or taking responsibility and then kind of offering it out there to some other health practitioner to tell you what's wrong. And so I look at screening as that kind of aspect to me. Yeah, we're told to do it, so we go and we screen and things like that. But there's no kind of prevention on people's behalf. They think it's a substitute. They're like, oh, okay, well, I'm screening, so I don't really need to take care of myself. Or I'm screening so that there's no like kind of personal responsibility that I have to take in my own care. And that's where I think the disconnect. So to me, I think that both obviously are really the best, but I think that you have to do both, that you have to take that responsibility and that sort of commitment to yourself. And it is a commitment of like taking care of yourself. The whole thing of, you have to put on your own air mask before you can put on the mask of anybody else. Like we have to take care of ourselves and do everything we can do that's within our own power. And then in addition, we get screened when appropriate. And, whatever you speak to your health practitioner about when they feel that is.
Thank you, Jan. Dr. Neelima.
I think I like how all three of you have explained the connection between bodies and pathology and then classified screening and prevention according to that. I think the general population, like Jan says, doesn't actually understand why screening started in the first place. If you go back to the World Health Organization, it was about preventing deaths. Screening is about finding enough caseload through a procedure to detect enough cases to prevent a significant number of deaths. That was the original premise of what screening meant. Unfortunately, with breast cancer, what happens is that with screening, you just get a whole lot of people who are worried well. So we don't have enough accuracy with the screening tests we're using currently to give us enough leverage with that modality to actually pick out the ones who definitely have a kind of breast cancer that's going to affect their longevity. We don't have that accuracy yet, and that's where screening is failing us. The goal of screening is very noble, but the way it's panned out over the last 20 or 30 years hasn't delivered what it set out to do. And then because of that, and exactly what Jan said, people delegate the responsibility for caring for themselves and doing whatever needs to be done to prevent stuff that cuts short their longevity. And it's not just breast cancer, it's everything that cuts short our longevity and quality of life as we age. To screening, thinking, oh, I've done my annual mammogram, so I can leave the breasts at the clinic and run the rest of my life and carry on, drinking and smoking and being obese. It doesn't work. It doesn't work like that. So everything that gives us longevity and vitality and energy in old age is actually also contributing to vibrant health that helps prevent all of the factors that lead to cancers anywhere. And it just so happens that in women, the breast is the one that manifests most of the most commonly detected female cancer.
Thank you, Dr. Neelima. Wow. Wow, I love it. Melissa, can you comment, take it a little bit? What are the methods? They've been mentioned, but let's be really clear and specific. From your perspective, what are the methods for screening that are available right now?
Well, I would say my favorite one is thermography because, as Dr. Anna knows, it can find inflammation before that. The way I see cancer is there's been inflammation going on in a part of the body for usually a really long time. And so there's a buildup there of toxins and pathogens, and the body's trying to find a way to remedy that. And sometimes that's through like the production of a lump because the inflammation's been going on so long. So the beautiful thing about thermography is that it can detect that inflammation early on. And so I feel like it's a better tool to play in prevention, because if a woman knows there's inflammation there, there's so many natural things that can be done to then prevent that from turning into a full-on disease process. So there's that. And then mammography. I don't believe that the medical system is using ultrasound for screening at this point. It's just mammography. Some people will pay privately for MRI kind of mammography. But that's my understanding of like what's being used for screening right now. And thermography, as you all know, is out of the system and it's private pay. Yeah, so I would say there's some, like everybody has said, there's kind of some overlap between screening and prevention. And the prevention piece that I would say is really important is taking care of one's lymphatic health, which goes back to liver health as well, because 30 to 50% of the lymphatic fluid is produced by the liver. So if the liver's congested, which almost everybody's in the world's liver is right now, including children, which I see all the time, due to the toxin overload. That's really going to affect breast health if we have lymphatic stagnation, because that fluid that's produced, the lymphatic fluid that's produced by a congested liver, is going to be more sticky, stagnant, and not flow as well. So it's going to make people more likely to have autoimmune diseases and cancers and just all sorts of inflammatory conditions. So keeping moving, rebounding, and regular breast health, but also lymphatic self-massage is something that I talk to everybody that comes to me with chronic disease. And as like a daily practice, just a couple minutes every day, I teach people how to do it. I have a video on my website, on my blog, that we can link in the chat later, that goes over a very simple practice where you're massaging the main big lymphatic points. And I would say that's super, super important for prevention and trying to avoid toxic exposures, including injections in your arm. Vaccinations, I would say, was one of the causes of my breast cancer as well. I'd had a flu shot a year or two before, and I know the mercury in that had something to do. It was in the same side. So just practicing like a natural, healthy lifestyle, trying to do things as naturally as possible and cleansing the body, keeping it clean. Those are all preventive strategies. And I talk to people about their emotional health as well. If you have all these emotions build up in your heart chakra, it really will cause density in the breasts and slow the energy flow down. So lots of things to do preventatively.
Fantastic, thank you. Dr. Anna, can you tell us specifically what is medical thermography? What is that? Because some people
Sure.
might not know.
Sure. So thermography is basically using infrared to look at the health of the breasts or other body parts as well. But basically it's trying to pick up a heat pattern from the breast based on the internal environment of the breast. If there's increased blood flow, then the breast will look hotter. And so it can pick up on things like inflammation or, newly developing vasculature. If there is something trying to grow there, then we can see that in thermography as an increase in heat. And so typically what we do is do like a baseline image, and then 3 months later we do another to compare to see if something's changed. And usually if nothing's changed, then we consider that stable. And then after that, the patient comes in annually or every 6 months, depending on whether they're there's concerns or they're noticing something different. If we do find that there's been a change in the baseline, then I typically would try to get the person to go for an ultrasound. But it's difficult to get one, actually, unless you paid for it. So often most of the women that I see don't want to get a mammogram. And it is sort of a test that, when you think about it, it's like you're squishing delicate tissue and then radiating it. And I know there's lots of studies that say that, oh, it's so minor, the radiation, it doesn't do anything, but it's not really causing extra cancers. But I don't know about that. Anyways, but it's it's sort of it doesn't make logical sense almost, right? You've got this very delicate tissue that could be prone to DNA damage, and then you squeeze the hell out of it, and then you radiate it for a few seconds. And so it's like, okay, I don't know. It just doesn't seem like the one thing that I want to do with my breast. So so I always sort of encourage, maybe talking to the women, because I can't order any imaging. Then I try to encourage the women to go back to the GP, and there's and ask for an ultrasound, and we see what we can do there, so that we have a second way of looking at the breast. And the ultrasound, so the ultrasound, mammogram, and MRIs are looking at structural changes within the breast, and the thermogram is really looking at more of a physiological change. And it's pretty neat, because sometimes we'll notice a change in the baseline. The person will go for an ultrasound, nothing is found, but there is maybe some discomfort. And so we'll, start some kind of a treatment, and then they come back 3 months later, and there's like a complete change in the thermography. So it's, you can really see, you can really track, that, things are much better, and the person feels better too. Obviously, you've got the symptomatic relief, but you can now see it physiologically as well. So so it's a pretty neat kind of tool. Yeah.
That's great. And I know I had a thermography session years ago, and I don't know if they still do this, but I had to put my hands in ice cold water, and then there was an image taken. Do they still do that? Who can comment?
The camera that I use I'm not required to do that anymore. It's more of an advanced kind of camera. So so that's not part of it.
And you just hold the camera and you take images of the breast area.
There's no compression. You're just kind of sitting in front of a camera. It's sort of a bigger, I don't know. It's like 10 by 10 inches or something. And so you just sit in front of it, and I ask you to rotate around a stool, and and that's it. It's fairly easy. And then I usually follow it up with a breast exam, because like any, type of imaging, there's always room for, things that don't get picked up. So I do a breast exam. I always do a breast exam, and I teach women how to do it too. Because if I do find that the tissue, there's something about it that just doesn't feel right to me, then I would, even though maybe, when we get the report back from the people that analyze the images, and it says that, it looks fine, but I do have, an inkling about some area, then I still want to, do follow up. Yeah, I want to follow up with that.
Great. Thank you so much. Jan, risk factors and environmental factors. I know we've alluded to some of them in other bits of the conversation, but from your perspective, what are the risk factors that impact breast health? And you're still muted.
Used to my dog, who I'm always afraid is going to bark. So one of the things that we didn't bring up in screening, but I wanted to bring it up just because I spent, 3 or 4 years in at the Rotenberg Cancer Center, breast cancer research. And one of the things we were doing was genetic testing for breast cancer risk. And so BRCA testing. And so things like that, which I think we have to remember that I think, I'm not, I don't want to say that genetics is everything, because I think lifestyle is a huge contributor And as I learned when I was testing women for the BRCA1 and 2 genes, that it's a very personal kind of journey for people, whether they decide that they're going to be, what they decide to do with that information, let's say. We had people who opted for like prophylactic mastectomies. And then we had women who were just like panicked and went in sheer stress mode and like really freaked out. And I'm not so sure that I think the emotional ramifications and stress of knowing, quote unquote, put them at a disadvantage. And so I think you have to know the person and know them. So I just wanted to bring that up. So family history and and that's been expanded out now to like any form of cancer. It used to be breast cancer. Now I think they ask you for any hormone related cancer or any cancer in general that's in your family, especially within parents and siblings, things like that. And so that's one. I think the other risk factors I look at are like smoking, alcohol consumption, diet. Dr. Nalima mentioned diabetes, type 2 diabetes, I think especially obesity, which goes along with diabetes, but not necessarily. So those are the things that I actually talk to people about all the time. So those are the major risk factors. I think toxin exposure, certain professions in general, I think there's a higher rate. Here in the US, I think hairdressers or hairstylists have a higher rate because of their exposure to things like dyes and chemicals and things like that. So I think you have to look at, what kind of, what that person does for a profession, whether they've had children or not have had children. So whether they've actually lactated, I think plays a significant role. So those are what I'd like to, but I'd really, I feel like I want to leave it up to I don't want to take it all.
That's great. Thanks, Jan. Dr. Nilima.
I think Jan covered a whole lot of them. It's also, I think exercise is one big one. I remember when the WHI study came out and there was a scare of HRT and breast cancer, and they did a whole lot of studies on what increased the risk of breast cancer. It was being obese and not exercising was much, 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 much worse than taking HRT. And I did a research paper about the effect of alcohol on the amount of circulating estrogen. And just one drink of alcohol increases circulating estrogens by almost 30% in the 12 hours after that drink. So that's how bad alcohol is for, upsetting your estrogen levels. And that's pretty expected because, alcohol goes straight to the liver. It affects the liver's ability to metabolize a whole ton of hormones. And unfortunately, estrogen is one of the key hormones that's metabolized in the liver. And having estrogen excess in breasts that are prone to have cancerous hotspots will make it a lot worse. I think trauma is also one thing that we don't always pay attention to. I remember there was a study done on nurses in England, and they have pockets and watches that they hang on the left breast, and nurses who always jammed their pens in the pockets on the left breast often had repeated trauma in the left breast, and that a significant number of those nurses were found to have cancer in the left side.
Wow.
Understanding many different factors, but over and over again, we've seen research papers come out, promoting exercise, reducing stress. Like Jan was talking about, exploring levels of stress and tension and anxiety. So even things like laughter therapy work to reduce stress significantly, and sleep disturbances, sleeping correctly, nutrition making a big difference. And there's a difference in cancer detection in fatty breasts and small breasts. So that makes a bigger difference also when going through screening protocols.
Thank you. Melissa, anything else to add around risk factors or environmental factors from your perspective?
Well, the circadian rhythm that is huge, and I know a lot of us are using blue light blockers and things like that now. And I think that's really important to get deep, proper sleep. Yeah, I've got mine too. I just not wearing it for the webinar.
Exactly.
Yeah. So, and what I do to keep my circadian rhythm healthy, in addition to the blue light blockers, is I go outside every morning at sunset and go for a walk, because there's the most red and infrared rays coming from the sun at the sunrise and sunset. So in terms of our body being able to stay in the same cycle as nature and the sun, if we go outside and we get the sun rays at sunrise and at sunset, it's like our body gets the instruction sets from the sun about what time of day it is, and sort of like our sleep-wake cycle. So in terms of keeping that regular and resetted, that's really important, in addition to blocking out that artificial light. So yeah, and I think I've already mentioned some of my other ideas about risk factors. So that's yeah.
Thank you. So the next question would be around, and we've been talking about this throughout, but how do you actually reduce stress and improve your emotional well-being? What are some tips and strategies from your research, from your practices? Maybe tell us a story of a client or two. Dr. Anna.
Yes, that one's always the hard one to, it's sometimes easier said than done, but there is, I think, looking at your life and identifying maybe the things that you're doing that you do to cope, and so sometimes people go, yeah, I always, I turn to food, or I watch a lot of TV, or I drink more wine. And so, one glass becomes four, and then suddenly the whole bottle is gone. So looking at ways in which, first identifying that you're doing these things, and then doing something about it. How can you make your life a little bit easier? Can you ask somebody for help? And I think it's, sometimes it's hard for women to ask for help. I think also just, doing things that are exercise, things that you love to do, that give you joy, finding time to do those things like painting or, whatever it is that you really like. I think that will, nourish your soul and help bring down stress. I think, exercise is a big one that, does contribute obviously to a sense of well-being and helps so many systems. I think I do encourage women to try to find time for exercise, because I find that that's one that really doesn't get done. It's sort of everybody else, let's do all of the things for everybody else. And then that's at the bottom.
Thank you.
So I think that's, one of the things that I think it's big.
That's great. Jan.
So glad you went to me next, Esther, because I have a lot to share on this one. I have a number of things I would recommend to people, and stories I could tell. I've been teaching yoga, so yoga is always a big one for me personally, but not everybody is a yoga person. And so I think movement in general, I encourage people to do anything that's going to help them express like that sort of creative and sort of flowing energy. And that could be dancing, it could be singing. But one of my favorite things is what I call all walks or forest bathing, which is basically getting outside, taking a walk, and really taking in the awe, the beauty of what's around you. It's a really wonderful way to calm down, lowers cortisol levels, lowers blood pressure. There is so much, the science around awe is amazing. And what it does physiologically in the healing process, and also just our well-being. So I really love this whole idea of looking, and that could be in your own home. Like, it doesn't have to be, a planned thing. I have a friend who was going through a really hard time and had a really busy schedule. She had a cancer scare. And one of the things she used to do is on her way to a meeting, right before, like, she'd get out of her car, and she would just stand there for like 5 minutes, taking in her surroundings. Instead of rushing into the appointment or whatever it was this opportunity to like look at the sun, see how the clouds were going through the sky, looking at the people that kind of walked around. And she thought to her, like, wasn't like in her busy schedule, I was getting her to carve out necessarily a period of time to meditate or to take a walk. But it was an opportunity for her to get outside, breathe in some fresh air, and actually take in the beauty of her surroundings. So I think it's like just easy ways to me. That's what I like to do for people, make it easy. Because I think when you talk about carved out time, sometimes people get stressed on top of it because all of a sudden everything is overwhelming anyway. In a lot of our society, the way people live, they get very overwhelmed very easily. And I think I like to keep it simple. So that was one of my favorite stories because it was really easy, you know.
Thank you, Jen. Melissa.
Yeah, I would say this is the thing I talk to about with all of my clients. I work with mostly women, and some children too, but it's trying to make it like blisscipline is what I like to call it. I just came across this term like a month or two ago, and I was like, that's what I'm trying to do. I like to make just a lifestyle, not that it has to be like 1 hour a day you do this, just like Jan was saying, this full hour of yoga and then another hour of meditation. A lot of moms get really stressed if you think about adding all this self-care. So what I try to encourage them is to add a few minutes here and there if they don't have a big chunk of time. I personally, in addition to the sunrise and sunset walks, I go outside and put my bare feet on the earth every day. Even if I just have a couple minutes in the morning to do it, it's a huge reset, getting those negative ions in the body. It helps clear a lot of energy and calm the nervous system. And I do some breath work, just some conscious, slow, deep breathing. And I do meditate every day, and I encourage people to meditate every day, but it doesn't have to be an hour or two. Even 3 minutes in the morning is great. But I would say what's even more impactful is in those moments where you catch yourself like in a stress cycle, you stop and literally take like 30 seconds or a minute to just breathe and say like, okay, I'm caught up in this stress right now, but I can connect to my light, to my divinity in this moment and calm myself down. So doing that like throughout the day, preventatively, but also when you're caught up in the stress, I find is really impactful for me to get out of that stress cycle. And I also talk to people about when I read one of Gabor Mate's books, I think When the Body Says No or something like that, he talked about how we get, if we had a lot of like chronic stress in childhood, maybe not necessarily a big trauma, or maybe there was a big trauma, but just like a really chronically stressful life at home or at school, we get addicted, like unconsciously addicted to our stress hormones. And so we continue to make choices. We're creating that reality where there's more and more stress that's created all the time because that's what we're comfortable with. So we have to slowly, day by day, start to reprogram that inner child that doesn't know how to be any other, like doesn't remember how to be, in that the comfortable, like how we were born is just like being in that relaxed state and remembering our divinity. So it's not about like making a sudden change all of a sudden and having 2 hours of self-care a day. It's really about working with that younger part of you that learned that most people didn't have like role models for self-care, and they need to relearn it. We need to reparent ourselves, and it's got to be a little bit by bit because you can't just suddenly reprogram your nervous system and suddenly stop all of this addiction to cortisol and adrenaline and everything. It needs to be slow progress. We have to have patience with ourselves and the way we're programmed. So yeah, so those are other things that I would add.
Well, Melissa, I don't think that you're very passionate about any of this, or really, you should show a little bit more enthusiasm. No, I'm kidding. Clearly, you love this, and this is your messaging to all the people you work with, which I think all of our practitioners here. I was just getting the wave from you. It was brilliant. So just before we go to our Q&A section, Dr. Neelima, do you have any thoughts in addition to what all these other fine women have shared, just to wrap this section up?
No, it's absolutely brilliant. I discovered that my stress is very connected to what I eat. And I would have never noticed because I've been meditating for a long time, all kinds of psychological interventions and practices and EMDR, etc. But when I did WildFit, and Esther knows about WildFit, when I did that, I remember week 6 waking up feeling grateful for just grateful. And that was such a brand new feeling for me because all my life I've got to do these gratitude journals. And it's like the punishment of this. You meditate 1 hour twice a day. It's like, sit on your mat and meditate, do your gratitude journal. And then it's like waking up, waiting, I actually feel grateful. And I was like, yes, I got grateful. And then I also realized that my brain was much clearer. Things were so much more amazing. I was more appreciative. The colors came back in my life, and I thought, oh, so this is what it feels like to not be stressed. And then that got even better when I started doing PQ. And exactly like Melissa says and Jan says, relaxing yourself and de-stressing is a moment-to-moment job. And I remember a book by Marcy Shimoff. She's written, Happy for No Reason. And one of the things she talks about is that, your past is a story anyway, and the future doesn't exist. And then it just knowing that that's you only have now. You actually only live breath to breath.
Wow, that's amazing. I put that in the chat. Your past is a story, your future doesn't exist. So living in the present. On that note, I am going to share my screen. We're going to do just 4 slides, and I'm going to share with you a few things for moving forward. And we're going to do that. Let me move this 1 second. It's just not working. Give me 1 second here. There we go, from the beginning. There we go. Can you see my screen? Excellent. So Mind Myself is all about offering you more choice and helping you become your best health advocate. That's what we're all about, because you matter. And our next event after this one is cultivating sexual health and intimacy. And we're going to be talking about things like you see here. What happens as we age? Why does physical discomfort or pain happen during sex? What can we do about it? The fear of aging, and how does that impact our sex lives? Sexual health is part of our overall health, etc. And that is going to be 6 weeks from today on November 1st. I'm hoping Dr. Neelamad is available. We've put her on our charts, but we'll see if she's available. So if you sign up for that today, then you are going to be entered into a draw for, this is a giant oversized wrap-up blanket that has waterproof backing on it, and I will mail that to you if you sign up today. You'll be entered into a draw. And the other thing we have is a light box backlit message board with some letters and numbers. And so you can use that at an event where you happen to be. And so those are our 2 prizes from our sponsor, one of our sponsors, Brand and Ink, Spread to Love, and Gift Basket Co. And I also wanted to share with you, so our sponsor for this event specifically is Light Life Technologies. And this is a personal harmonizer that she sent me, and it gets charged with this ring. I highly invite you and encourage you to look at Katharina Sperling's website. It's Light Life Technology. And she's not giving anything away, but she helped make this possible. So we'll ship those 2 other products anywhere in Canada and the continental US. But yes, do check out Light Life Technology. Phenomenal things are happening with her. I'm also offering a 2-day stand and deliver workshop. Bill and I teach speaking and presenting, and we're having a workshop on October 5th and 6th in Vancouver. And I'm going to give away, that value is $700, $695, as you see on here. And I didn't say the prices of the other, but I could be charging $50 for these sessions. This amazing wisdom from our practitioners is priceless. And the picnic blanket is a $55 value. The backlit box is about $40 value. And then we have, so that's $840 that I'm giving away today. And Bill Chalmers, who is a phenomenal coach, an amazing person. Dr. Neelima, can you attest to that? Yeah, we're giving a 1-hour coaching session away to some lucky person here too. So there's Light Life Technologies again. Those are other sponsors. And if you sign up for our next event, and Megan will put that link in the chat, we would welcome you to be part of it. And these are ways to stay connected with Mind Myself. You can go visit our website, which is amazing, so full of information. And if you ever want a tour, I'm happy to give that to you. And we also accept donations. This is a completely self-funded endeavor, looking for sponsors, looking for other participants. But if you're wanting to donate, happily receive that. We also support a charity called Blind Beginnings. They help children and their families of either blind or sight reduced boys and girls. And then there's also an African organization called the Vase of Transformation that you could participate in. And this group, I just want to tell you what they do is they support young women who do not have menstrual products. I mean, they use things like rags and polythene and newspapers and rubber from tires, and we think nothing of it. We go into a store and we buy the products that we need, and not everybody in the world is as fortunate as us, so this happens to be somebody that I connected with. There are many ways to stay in touch. We would love to carry on that conversation with you. Please feel free to do so, and thank you again for being here. So now we are going to go into the next part of our conversation with a Q&A, and I have some questions already from the chat, but please put your hand up if you have specific questions that you want to ask of the practitioners. And I'll start it off until I see some hands. From Bill, what's the difference between thermography and ultrasound, given the pushback now regarding imaging babies in the womb? And maybe you haven't heard about this, but there's a woman in our lives called Billy Harrigan, I think that's her name, and she helps train people to become birth companions, and she has a very unusual perspective on ultrasound. Originally, it was discovered or developed to detect enemies in water. That's how ultrasound was developed. So we're flooding these babies, and it's become just a matter of course that we do this. And I'm not sure what your perspectives are as practitioners, but I would love to hear some comments. And so what's the difference between thermography and ultrasound, since we're talking about breast health? So Dr. Anna, I think you're wanting to jump in on this one.
Yeah, I mean, the difference is what the thermography is using infrared, and the ultrasound is using sound waves. I think of ultrasound as fairly benign, but maybe I'm wrong. Maybe all this time I've had it wrong. The difference, I mean, with ultrasound, you have to have contact with the breast, with the infrared camera, you don't have to. You're pushing, you're putting, pressure. I think of they're looking at different things. One is looking at, basically density changes that you can see because of how the sound is reflected back, from the tissue. And infrared is, just basically picking up on hot spots or temperature, temperature gradients within the tissue that you're looking at.
Great, thank you. Melissa, do you have anything to add either about that or about ultrasound? I saw you nodding your head.
Yeah, probably about 10 years ago is when I first read a research article that there was increased rates of neurodevelopmental type issues in babies who'd had ultrasounds. And I think the more ultrasounds they'd had, the more risk there was. So that was the first time I'd ever thought that, oh, maybe there could be an issue with ultrasounds, but I have not looked at whether there's any research on that with breasts or any other tissues other than developing fetus. So in my life currently, I do everything possibly naturally. I haven't seen a doctor in a really long time, like 7 years probably. And I would see one in an emergency situation. But I'd rather work with like the intuitive piece and potentially something like thermography. So that's all I have to say about that.
Okay, thank you. Dr. Neelima, from the straight on medical perspective.
I think that this research that looks at neurodevelopmental disorders, there were too many confounding factors in that research. And ultrasound machines today are so advanced, and there's so many different ways that we can use them, and so many different types of probes. The frequencies vary depending on the size of the organ being studied. Say that there's a lot of babies wouldn't exist if we didn't have ultrasound. You know,
Right.
because a lot of fetal surgery, detection of fetal abnormalities, a lot of babies who survive today probably wouldn't have if we hadn't had ultrasound to detect those issues. So every technology comes with its advantages and disadvantages, and I think one of the difficulties we run into as human beings is our own intellect, and intelligence works against us sometimes. We try and over diagnose and over-treat things that nature would probably, take its course and solve a lot of problems for us. And, I'm living with a dad with Alzheimer's, so we kind of think, maybe we weren't supposed to live that long. Maybe, some things just weren't meant to happen. We just interfere either too soon or too much or too late or not enough, or maybe, with the wrong things. And I just sometimes, as a doctor, I get really confused because I'm sitting in this place where I don't want to be in judgment of somebody who takes a particular decision, because in the end, it is a very individual decision. And sometimes when I'm counseling parents about, an abnormality that's seen on ultrasound, or maybe they're doing Down syndrome screening, and the whole counseling process for screening is actually getting the parents or the caregivers to understand what are they going to do with the results. I mean, why are you doing a test, or why are you doing a procedure? And I think asking the question why can help them to narrow down their decision making. And suppose, well, whatever happens, I'm never going to terminate the baby. He says, well, then don't go down that path. Whatever happens, I'm going to look after it. Then don't go down the path where you're exposed to people who are going to try and convince you to terminate or do something drastic that you'll regret afterwards. And then there's the other extreme. The mother says, I can't cope. I just can't cope with an abnormal baby, right? I have no support whatsoever. And I am nobody to judge either of those parents on the decisions they make when the technology is available. So it is a conundrum, and it's very difficult, as a clinician, to be on the side where you don't want to have to make that decision for somebody else, because either way, it's a difficult. Whether you terminate or don't terminate, you decide to operate or you don't decide to operate, and the whole process, and Melissa knows this, we're going through loss all the time, the trauma of loss of so many things. I think the hardest thing that any parent could go through is losing a child.
Thank you, Dr. Neelima. Yes, and the person that I was mentioning, Billy Harrigan, she says, yes, if there is an issue, then absolutely do it. I think her caution was, if we just do it as a matter of course, because that's what we're being fed all the time. Oh yeah, you just go get an ultrasound, and then you get another one, and then you get another one. Perhaps we might pause. And that's just in terms of a fetus. In terms of a breast exam, I personally would prefer to have ultrasound rather than a mammogram, just saying. And I would start with the thermography. That's what I would start with. Absolutely. Go ahead, Dr. Neelima.
It's I think when you say you'd rather have an ultrasound, there's a difference, because the sensitivity of ultrasound in menopausal breasts is very, very low, because the breast architecture changes. Your glandular tissue decreases a lot, and it's mostly fatty tissue and fibrous tissue. And the collagen strands in between the fibrous tissue becomes very flimsy as we age. So ultrasound doesn't pick up stuff much in menopausal breasts, and that's why digital X-ray mammography does become the preferred modality if you're looking for something. But in women under 40, menstruating women, sonography, they call it sonomammography, is probably the preferred choice.
I love it. Thank you for that wisdom. That's amazing. I'm going to move on to another question. And somebody else asked this. Zora suggested that we talk about this, but underwire bras. I have been looking for a different kind of bra for years, and I haven't found any that are functional that don't have underwire bras in them. I mean, you can wear sports bras, but they squish your boobs, and they're just not the same. There's no support, and I think, what the heck? So I would love some comments from underwire bras in particular, and then after surgery, after breast surgery, like a breast reduction, what do you do? Jan, can you start us off? I know there's some vigorous head noddings in here, but Jan, can you start us off on that? And then I'm going to go to Dr. Neelima.
Okay, so for underwire bras, I have always cautioned people against them. I'm not a huge advocate of underwire bras. I've always read that they can actually damage some of the tissue underneath, and therefore can cause your breasts to sag. And it seems a little bit harsh. Now, that's not saying that I believe that support is good, especially when we're talking about what I think Dr. Lima spoke about originally, which was like for people with very large breasts, like, so that upper back pain and the slouching and the whole like dumping of the body forward, which has a lot of other ill effects anyway, from closing off the chest to preventing breathing properly and all those other things. So I think it's vital that people actually support themselves, but I'm not into the whole like, okay, I'm going to compress and I'm going to kind of use metal to kind of abruptly lift the breast. I'll leave it there.
Dr. Neelima, a brief one, then I want to hear from all of you on this. So Dr. Neelima.
About you're asking about post-operative breast support?
Sure, and underwires. Go ahead.
Underwires, they're the same, the trauma, the constant irritation, trauma, digging in. And that goes back to things like sizing and getting sized up correctly, having your measurements taken. And I'm much more for the companies who actually understand between morning and evening. What size are they measuring? Forget about the first half of the cycle and the second half of the cycle. They can change, in a few hours, depending on your hormonal cycles, what you've eaten, what you've drunk, all of that. So you need material as well as textures and design that expands and contracts and supports. And particularly, I think the design of bras needs to undergo a complete radical change. Really, really does, especially materials. And I think it's even more obvious now as we're getting larger. The world is getting larger because of obesity. And a lot of women, as we get older, our breasts become more fatty, and they also become larger because of excess estrogen circulating because of obesity. And naturally, the structure and function of bras has to change.
Absolutely.
To be much more supportive.
I fully agree. So Bill and another woman are working on it. We want to conscript you, Dr. Neelima. Yep. Dr. Anna, what do you have to say about underwires and bras, and where should we go and look for something?
Yeah, I absolutely hate the underwires. I recommend wire-free bras, and the sports bras, I think only when you're doing things where you're really bouncing up and down, but not something to really wear regularly, I think. Especially ones that are like super constrictive where, nothing moves. I think the lymphatics are just really affected. Nothing is circulating. So, and then it builds up fluid in the breasts, and, you're not moving your toxins out. So I absolutely, dislike any of those types of bras. I do just, I sometimes recommend I don't know if I can say, the Cloud9 bras. They're like Warner's, sort of fairly inexpensive, but they seem supportive. And they don't have wires. I'm sure there's other brands, but that one's one that comes to mind. I think that, it's interesting because I am seeing, so, I have a daughter, she's 17. And, when she became a teenager, I was seeing all these pictures on Instagram of her friends, et cetera. And everybody had the boobs on a shelf, basically, with these really constricted bras. And anyways, wanting to create more cleavage. And now I'm seeing a little bit of a change. where I see a lot of girls now with no bras, which I think is nice. It's a nice change. And I think, oh, maybe there's some, sort of evolution to, or, they're evolving their thinking towards, oh, let's just, have things be more natural. And so anyways, I think that's good. It's a good move.
Thank you. So when you're really young, that's really good. When you get a
No
little
bra.
older
Yeah.
and
I
there's
mean,
slippage,
you can wear a bra, but it doesn't have to be that supportive. They don't need to be on a shelf. Like, you know what I mean? Those
yeah,
things are
totally.
like feats of engineering, those bras.
I totally agree, and I agree with Dr. Nilima. We need a whole restructuring of the bra industry, and I don't know, including fabrics. When was the last nice cotton bra that you
They're hard
had?
to
They're
find.
all plastic because they're nylon. Melissa, I'd love to hear your thoughts.
Yeah, I like what everybody said. And I'm an advocate of either going bra free or something that feels supportive, that you can still take a deep breath in, that doesn't impact that doesn't feel restrictive at all. I've found in Nelson, BC, we have a lot of kind of hippie natural shops here, and I've been lucky to find some like organic bamboo and kind of hemp products that are really soft and still supportive and beautiful looking. I wish I knew the brands of them. I don't remember that, but there are some out there. So yeah, I'm sure doing a search on some kind of organic, natural, comfortable product, you could find some.
Oh, okay, well, I'll keep looking, and let's absolutely share those in the Mind Myself community. Send them to me and I will make those known, because I personally will do the research myself, and we're on this warpath because it really does need to change. And I have to say, I've looked online and there have been ads. Oh yes, the bra industry needs to change, and here's this grandmother who does. No, they're crap still. There's no support whatsoever. I've tried about 5 of them, and no, it's just not there yet. So somebody needs to do something different. And I like Rusty's suggestion in here. Nursing bras might be one way to start. Even if we're not nursing, I think they're made and designed a little bit better. And I don't know why the rest of us can't get those, but there we go. Oh, and Jan says a US company called Pact is quite good. And Gen Z is changing things in this regard. That's good. So we have another question here. And I know most of our participants here are over 40, but what would you say to somebody who's just approaching 40 or in their 30s to say, okay, how do I start prevention early? What exactly should I do? Let's explore that a little bit more than what's already been said. Jan, I see that big smile on your face.
First of all, I think you should be starting before 30. No offense to anybody. I think you should start early, because I think it's really vital to teach young girls about relationships to bodies, because I think that's where it begins. When we're adolescent or even younger, is that whole body awareness. I guess the thing I would remind people to do is, yes, there are just so many things that you can do from, that self-exam. So to me, the things I began to do, because I also had a breast cancer scare at one point, was I eliminated toxins from my environment. I couldn't control what was outside my home, but I could control what was inside my home. And so I pretty much went totally green and started to really be careful about the things I applied and what I was actually, applying to my body, because your skin's your largest organ, what I was exposing myself to and stuff, and things like household cleaners and things like that. I mean, I think the average woman walks out the door with something like 127 chemicals on their body between, shampoo, conditioner, hairspray, makeup, and then anything else they might be using in the home. So to me, start and I'm not saying you have to be extreme. My rule was I would use it, and once it was done, I wasn't going to replace it with something bad, because I'm not a wasteful person. So I was like, okay, just when I'm done, I just won't buy this again. And then I think for me, it was really looking at what I ate, eliminating processed foods, trying to go more organic when I could, almost totally if possible, shopping the perimeter of the store where the fruits, vegetables, meats, things like that were. and starting to really cultivate that body awareness. So that's where I think I would begin as far as prevention, like really good habits. And then I'm a huge advocate of journaling, and like keeping a health journal for yourself, because I think that we need to have, I mean, even if you go to a physician, physicians like data. And so if you go into them and you say to them, oh, well, I haven't been feeling well, they kind of look at you and like, well, how long? And you don't know. But if you have it documented saying, oh, okay, well, you know, for the last 3 weeks, I noticed I'm really not sleeping well. They can then do something with that information, your health practitioner. And when you're not as clear or you're vague, there's kind of like this, well, that's, and then I don't know that they pay attention as much.
Thank you, Jan. That's great. These are all such great practical strategies for all health. And we're talking about breast health today, but this is the foundation of all health. So I love it. Melissa, I'd love to hear your thoughts as we wrap up here.
Yeah, I love the idea of teaching young girls about what like healthy menstruation is like flow, so that they can get in touch with their body, what's normal and what's not, and not have all this shame and stuff that tied to their menstrual cycles, their sexuality, their, and including their breasts and the pleasure of their breasts and all of that. Like, just encourage them to explore their bodies and understand what is healthy, and if something is out of balance, that they can be encouraged to seek help for that right away, so that it doesn't become a problem 10, 20, 30 years from that point. So I have a friend who leads like a girls circle, and she's helping these girls become women. And she really wants to focus on helping them, like, just the blossoming into women, not like being fearful of your period or fearful of breast cancer. It's really like the body awareness, like Jan said, and understanding their cycles, and just getting comfortable with being in their bodies. And so I do the same thing with coaching sort of my younger female clients, and that emotional awareness of what you're holding, like I said, in the heart, like early on, as early as you can, whether it's journaling, just, being conscious with the feelings that you might have suppressed and built up in your heart, and understanding how to move that. I think those are really, really important. And yeah, like Jan said, keeping as low toxin of a lifestyle as possible, moving the body, and yeah, I think that sums
That's
up my
great.
thoughts.
Thank you, Melissa. Dr. Anna.
Yeah, I don't know if I have anything else to add, because everything that Jan and Melissa said were, yeah, pretty much what I think. So yeah, I think that's all those really important things that we need to educate young girls on.
Absolutely, thank you. And it's never too late. Before I get to you, Dr. Nilima, it's never too late to begin any of these practices.
That's
And
true.
Nora has just sent a message to me in the chat. Body knowledge and boundaries. The more we know our own bodies and minds and hearts, the more connected we are, then the more we're going to be able to be proactive about everything. Dr. Nilima, take us home on this as a final thought. What can people do to be proactive?
I think they need to start talking. So I did a post once, say, if you can talk about your breasts, probably save your life.
Wow.
So getting comfortable with discussing breast lumps, breast disease. And I think that's where the men in the family come in, because most of the time women don't talk about breast because they think men will either be offended, or men only see breasts as something sexual. But men also have breast issues. Young teenage boys suffer incredibly because of man boobs. There's cosmetic clinics filled with men wanting to get the man boobs removed. Breast cancer is happening in men, and it's just as the incidence is increasing in women, it's also increasing in men. So this awareness and this ability to talk about breasts without necessarily always making them an object of lust is really, really, it's a really important skill to have. And families need to cultivate this comfort. It can save somebody's life. It will. It does save somebody's life.
Thank you. Thank you all. And I'm going to end with this one quote. Breast health should be a priority, as we've been discussing today, not an afterthought. Make it a habit to check and care for your breasts and all of your being, I would add, regularly. And that's a quote by Sheryl Crow. So thank you for taking the time to be here today. Thank you to the amazing practitioners who have lent us their wisdom and their time. It's midnight for Dr. Neelima right now in India. And thank you also to Katarina Sperling from Light Life Technologies for sponsoring this event, as well as the Gift Basket Company, Brandon Inc., and Spread the Love, and of course BFO Consulting from Bill. So please sign up for the next event, which is going to be great. Thank you for taking your time today to be here, and go visit the Mind Myself website. Thank you.
Thank you.
And we're doing this because you matter.